Ovarian cancer can be deadly if not caught early. A fundraising is happening this weekend in hopes to get more women aware of the risks. King 5's Christine Pei explains the symptoms women should know about in this week's HealthLink.
Ovarian cancer is serious because it is often found in its later stages. It's why doctors and survivors urge women to know the warning signs.
It was spring of 2009.
Drea Miser was vacationing in Hawaii that year when something felt off.
Felt really tired and, had just not a lot of energy, had some lower back pain. And I just honestly thought, oh, I'm dehydrated.
She brushed it off, but weeks later, her cat, Sam, made her think again.
My cat kept jumping on me and pawing on me. And I said, man, that actually hurts, like pawing on at the abdomen area. And so I felt it, and there was a really large, hard mass there.
Drea went to her doctor and got an ultrasound followed by a CT scan before getting diagnosed with stage 4 ovarian cancer. She was 32 years old at the time. Doctors immediately started her on aggressive treatment.
I said, I'm in, let's do it. If you're not giving up on me, then I'm absolutely in for the journey.
Drea beat her cancer, but others haven't been as lucky.
Unfortunately, for ovarian cancer, many of our patients do die of their disease.
Dr. Elizabeth Swisher heads a division of gynecologic oncology at UW-Medicine, as well as a breast and ovarian cancer prevention program at Fred Hutch. She says ovarian cancer is the 5th leading killer of women by cancer in the U.S.
It's not the silent killer that we previously used to call it. It's just that people's symptoms are ignored, either by the individual themselves or by their physicians.
The symptoms can deceptively be passed off as normal. They include bloating, getting full fast after eating, pelvic pain, and frequent urination. Currently, screening is limited to a blood test or an ultrasound, but even that can be limiting.
If we're ultrasounding the ovary, but the cancer arose in the fallopian tube, then we've already missed the boat.
Genetic testing can also detect the BRCA1 or 2 mutation, which can be markers for ovarian and breast cancers. Dr. Swisher says about 20% of ovarian cancer is hereditary, so knowing symptoms and family history are key.
And then ultimately just really knowing your body and knowing what normal feels like. And as soon as something's not normal for you, if it's persistent, if it's progressive for more than a few days, really go be your own advocate and get it checked out.
The Rivkin Center, a research and educational nonprofit focused on ovarian cancer, is holding its 30th summer run walk to raise money for ovarian cancer research. It's happening on Sunday at Seward Park in Seattle. The 5K run and walk begins at 9 a.m. Check-in starts at 7. For HealthLink, I'm Christine Pei.